Hi, this is a message for Kate Shields. Kate, hello, Jim Huddy here. We've met before. You might remember I'm a GP and the CCG lead for chronic pain, and I wanted to bring you up to date with where we are and what we're thinking, because I think you're the right person to talk to at this stage. So as you remember, we've done lots of GP education. Our drug prescribing rates have come down quite a lot, which is great, and we've achieved our 5-year plan there. But we want to move to the next stage. Always the question when it comes to from clinicians and non-clinicians is how to enable people to live better with pain. How do we provide the alternatives to medications, which is often so poorly understood by our doctors and non-doctors and patients as well. So there is a very simple answer to that question. There is a project that's been going on for many years by a colleague up country called Dr. Frances Cole, and she's worked with academics at the Durham University to explore and develop what's called the 10 Footsteps program, which are 10 crucial areas of living with long-term pain that people struggle with, that they need help with. Things like becoming more active, sleeping better, managing moods, eating better, feeling more energized, getting back to work, understanding what pain is and what it isn't, accepting it, managing drawbacks, and there's probably another. So there's 10 of those footsteps, and what we want to do is embed those 10 footsteps into almost the service delivery of pain within Cornwall. So this is sweeping, sort of cross-system working based upon a kind of map which is patient-centred and what patients need. And to do that, and the reason why I'm asking for your attention, is that we need a pain champion or two from each PCN, probably from the social prescribing team, maybe a health coach or a care coordinator. Not a doctor, I might add, because this is to do with demedicalising pain. And we think that, well, we've got access to training which actually for the whole county would probably cost less than 5,000 quid to cover everyone, and we might even have that covered with an application that we've put in. And these champions, we believe we can train in these 10 footsteps, to embed the 10 footsteps locally in their PCNs. We can embed it into the ICS as it's forming, and that's why, you know, I need your approval for this. Right, if we get approval right from the very top, saying this is what we're doing, let's get on and do it. And I think particularly exciting is that it'll completely mesh in with the personalised care DES that I'm not an expert at, but I think is coming in the next year or two. So that'll help PCNs to tick that box. It'll help us to get alternatives to pain embedded within the county, and also from the digital perspective and the digital, you know, that sort of forward view push that we had from Simon Stevens. Frances Cole is developing an app that can land, if we get the human sort of infrastructure in place, the app can land on top of what we've got. We might be able to personalise that for Cornwall and have people on their devices looking at what's around for them real time, for what particular footsteps that they're struggling with. How beautiful is that? Hope you like the idea. Look forward to hearing from you.